How to perform an ECG in the hospital and physician clinic. ECG is a common and routine procedure performed in both hospitals and physician clinics to assess the electrical activity of a patient's heart. The process of performing an ECG is relatively straightforward and typically follows these steps. Patient preparation. The patient is asked to remove any clothing from the waist up and put on a hospital gown to ensure a clear and unobstructed view of the chest area. In some cases, certain areas of the skin may need to be shaved or cleaned to ensure good electrode contact. Electrode placement. The healthcare professional attaches adhesive electrodes to specific locations on the patient's chest, arms, and legs. The number and placement of electrodes can vary, but the standard 12-lead ECG uses 10 electrodes. Connection to the ECG machine. The electrodes are connected to the ECG machine through lead wires, which transmit the electrical signals from the heart to the machine. ECG recording. Once all the electrodes are properly placed and connected, the ECG recording begins. The machine measures and records the electrical signals from the heart over a short period, usually a few seconds to a few minutes. Analysis and interpretation. After the ECG recording is complete, the machine generates a series of waveforms representing the heart's electrical activity. These waveforms are interpreted by a qualified healthcare professional, such as a cardiologist or trained technician, who analyzes the results for any abnormal patterns or signs of heart conditions. Documentation. The ECG results are typically documented in the patient's medical record, and any significant findings are communicated to the patient or their healthcare provider for further evaluation and treatment if necessary. In some cases, continuous monitoring ECG systems, Holter monitors or telemetry, may be used for patients who need extended monitoring beyond the short duration of a standard ECG. These systems record the heart's electrical activity over a more extended period, such as 24 hours or even several days, providing valuable information for diagnosing intermittent or episodic heart conditions. ECG is a non-invasive and safe procedure that plays a crucial role in diagnosing and monitoring various heart-related conditions, allowing healthcare professionals to provide appropriate care and treatment to patients with heart concerns.